What happens to your health when doctors dismiss older women? The truth will shock you. Did you know that older women are among the most underdiagnosed and dismissed patients in healthcare? Shockingly, studies show that women over 65 are twice as likely to have their symptoms ignored compared to younger adults. Today, we'll uncover the dangerous biases, hidden assumptions, and life-threatening mistakes that some doctors make when treating older women. Stick around because by the end, you'll learn the one phrase you should never hear from a doctor if they've secretly decided not to take you seriously. Before we dive in, hit that like button, subscribe, and comment below. Have you ever felt dismissed or ignored by a doctor? Your story matters and sharing it could help others. Part 1. They assume you're just old. The moment an older woman walks into a clinic, many doctors immediately filter every symptom through one biased lens: she's just old. This is not just frustrating, it's dangerous. For example, knee pain, probably arthritis. Fatigue, just old age. Memory lapses, normal for your age. This assumption often leads to neglect. Real medical conditions are dismissed under the guise of aging, and the consequences can be fatal. Case study: Joan, 72, experienced chest discomfort, dizziness, and nausea. Her first doctor blamed it on indigestion, but when she insisted on further testing, an EKG revealed small, repeated cardiac events. If she had trusted the first dismissive answer, her story could have ended tragically. Scientific evidence: research in the Journal of the American Geriatric Society shows that older adults are less likely to receive diagnostic tests for serious conditions, even when presenting with classic symptoms. Age is a factor, but not a diagnosis. Practical advice: if a doctor dismisses your symptoms as just old age, insist on further evaluation. You know your body best, and your health matters. Every single symptom counts. If you've ever been told it's just your age, drop a comment below. Don't forget to like and share this video so more women can be empowered to advocate for themselves. Part 2. They assume you're not tech-savvy, so they don't explain. Another bias: older women are often assumed to struggle with technology, so doctors skip education. They might hand you a prescription and say, "Take this twice a day," without explaining how it works, potential side effects, why it's necessary. This lack of information leads to confusion, mistakes, and even harm. Case study: Margaret, 69, was prescribed a complex cardiac regimen. The instructions were brief, vague, and rushed. She misunderstood dosing and experienced side effects. Her doctor blamed her for non-compliance, but the reality was simple: she was never fully informed. Expert insight: studies indicate that patient education drastically improves treatment adherence. Health literacy research and practice shows that older adults who receive clear instructions and explanations are 40% more likely to follow treatment plans correctly. Practical advice: never accept vague instructions. Ask, "Can you explain how this works? What side effects should I watch for? Can you give me written guidance?" Hit like if you've ever been frustrated by unclear medical instructions, and share your story in the comments. Let's make sure older women are treated like capable, informed adults. Part 3. They underestimate your pain. Pain is a signal, not a complaint. Yet women, especially older women, have historically had their pain dismissed as exaggeration or sensitivity. Case study 1. Rita, 76, experienced sharp hip pain. Her doctor assumed arthritis without testing. 3 months later, scans revealed a fractured pelvis. She had been walking on it, worsening the injury. Case study 2. Another patient suffered abdominal pain for months. Repeated doctors blamed constipation. Eventually, proper testing revealed advanced ovarian cancer. The delay drastically impacted her prognosis. Scientific evidence: research published in Pain Medicine shows that older women's pain is often undertreated due to age and gender biases, leading to delayed diagnoses and worse outcomes. Practical advice: your pain is valid. Track symptoms, insist on diagnostic tests, and seek a second opinion if necessary. Don't let assumptions rob you of proper care. If you've experienced ignored pain, comment below. Like and share to help others recognize that pain should never be dismissed because of age. Part 4. They assume you're not sexually active. Many doctors operate under the false belief that women over 60 are no longer sexually active. This outdated assumption leads to skipped screenings and untreated conditions. Case study: Celia, 68, re-entered the dating world after widowhood. After months of painful intercourse and bleeding, her doctor dismissed it as part of aging. Upon proper examination, she was found to have untreated infections, severe vaginal atrophy, and early tissue breakdown, all preventable with earlier intervention. Scientific evidence: a study in the Journal of Sexual Medicine highlights that older women remain sexually active, and sexual health needs continue well into their 70s and beyond. Ignoring these needs can lead to infections, untreated hormonal issues, and overall reduced quality of life. Practical advice: be proactive. Ask your doctor about sexual health screenings, hormone therapies, and treatments for vaginal health. Age doesn't erase intimacy, and it shouldn't erase medical care either. Like, share, and comment if you've ever felt your sexual health was ignored. Let's challenge the misconception that intimacy disappears with age. Part 5. They make dangerous assumptions about mental health. Depression, anxiety, and cognitive decline are often attributed to normal aging rather than evaluated seriously. Case study: Ellen, 74, complained of fatigue, low mood, and forgetfulness. Her doctor chalked it up to age-related decline. Further testing revealed vitamin B12 deficiency and early-stage hypothyroidism, both treatable conditions. Scientific evidence: the American Journal of Geriatric Psychiatry notes that misattribution of mental health symptoms to age leads to delayed treatment and worsened outcomes. Older adults are at high risk for both untreated medical and psychological conditions. Practical advice: track your mental health, request screenings, and advocate for comprehensive assessments. Age is a factor, not a verdict. Comment your experiences with mental health and aging. Like and share this video to spread awareness that psychological symptoms are never just old age. Part 6. They assume your lifestyle doesn't matter. Many doctors assume older women are inactive, uninterested in exercise, diet, or new health routines. This can result in generic advice instead of personalized care. Case study: Sylvia, 70, an avid hiker, was given standard osteoporosis advice without considering her activity level. Tailored exercise programs could have enhanced her bone density, but assumptions led to missed opportunities. Scientific evidence: research in the Journal of Aging and Physical Activity shows that personalized health plans significantly improve outcomes in older adults, yet assumptions often prevent this. Practical advice: share your lifestyle openly. Request tailored guidance rather than accepting generic advice. Your age doesn't mean inactivity or disinterest, it's a measure of experience, not capability. Like, comment, and share if you've ever felt your lifestyle choices were ignored. Encourage doctors to see beyond age. Conclusion: take control of your health at any age. Here's the bottom line: age and gender biases are pervasive, but you can fight back. Your symptoms matter, your pain matters, your sexual health matters, your mental health matters. Red flag phrase to watch: it's just your age. When a doctor says this, it's time to push for further evaluation or seek a second opinion. Final advice: keep detailed symptom logs, ask questions, insist on tests, and never settle for dismissal. Your life and comfort matter at every stage. If this video opened your eyes, like, subscribe, and comment. Share your experiences to empower other older women to demand proper care. Your health is not optional, advocate fiercely for it.